Hello everyone, I hope you're doing well. My name is Dr. M, and I would like to welcome you to the RX Masterclass. In this video, we'll be reviewing prescription and medical abbreviations. If you're a healthcare professional, chances are the first time you saw a prescription, it may have looked like this. But don't worry, because after this video, you'll be a pro and able to process prescriptions like these. These abbreviations are usually seen on prescriptions. They could be seen on soap notes, in labs, treatment and cure plans, and in pharmacy and hospitals. Now let's get into it. AC, which stands for before meals. Adlib, which stands for as desired. BID, which stands for twice a day. BM for bowel movement. BMP, which stands for basic metabolic panel. BP for blood pressure. CBC, which stands for complete blood count. CC, which stands for chief complaint. C-O, which stands for complains of, or is shorthand for complains of. CXR, which stands for chest x-ray. DC, which stands for discontinue. DNR, which stands for do not resuscitate. DX, which stands for diagnosis. ED, which stands for emergency department. FX, which stands for fracture. GTT, which stands for drops. HA, which stands for headache. H&P, which stands for history and physical. HS, which stands for at bedtime. HTN, which stands for hypertension. HX, which stands for history. IV, which stands for intravenous. MI, which stands for myocardial infarction. NKA, which stands for no known allergies. NPO, which stands for nothing by mouth. NS, which stands for normal saline. NSR, which stands for normal sinus rhythm. OTC, which stands for over the counter. PC, which stands for after meals. PMH, which stands for past medical history. PO, which stands for by mouth. PRN, which stands for as needed. Q, which stands for every. So if a prescription says Q 3 hours, that just means every 3 hours. Another example of that is Q2H, which stands for every 2 hours. QID, which stands for 4 times a day. RX, which obviously stands for prescription. SOB, which stands for shortness of breath. S/S, which stands for signs and symptoms. STAT, which stands for or means immediately. TID, which is 3 times a day. VS, which shouldn't be mistaken for verses, it stands for vital signs. WNL, which stands for within normal limits. And those are all of them. Thank you so much for watching, and please make sure to like and subscribe for more videos like this. I'll see you in the next video.